Let's go live to Canberra now. Joining me now is Border Force Commissioner Michael Outram. Thanks so much for your time, Commissioner. We saw yesterday the Prime Minister announce that the government is treating the coronavirus like a pandemic ahead of the World Health Organisation. What does this mean for your operations?
Yeah, good morning, Laura. Well, obviously, as the Prime Minister said, we're going to build on the response plan that Professor Murphy and his team have developed. So for us, that means now looking at the border, and of course the Australian border doesn't just mean our airports here. The border for Australia starts overseas when people form an intent to travel here. Everyone has to have a visa to come to Australia, of course. So we're now looking at the whole international travel scene and looking at as we have been doing, which airport routes are being taken by people, primarily, of course, these starting people out of mainland China. But as this spreads, we're going to have to monitor the hotspots around the world for coronavirus and overlay that with travel patterns. And then we'll actually apply our resources to the hotspots there. Of course, our intent here is to firstly reduce the rate at which this virus gets to Australia, of course, but also to try and delay that as long as we can.
Commissioner, what hotspots exactly are you looking at? How many airports overseas?
Well, at the moment we've been focusing on our near region, of course. We're very fortunate that where we are geographically, many people from around the world, they have to, of course, bound through hubs to get here. Apart from people in our region, it's hard to fly directly to Australia, so that gives us some choke points that we can focus on. And of course there are a number of those in our region. So what we would have to do, and we've been doing this anyway, Laura, is focusing on, for example, the Chinese students where they've been spending 14 days out of China and coming here. So we'll continue to monitor those sorts of patterns of travel. And, you know, people come through the Middle East, some people come through Asia to get to Australia.
Okay, so what does this mean for your personnel? Have you got more people stationed in embassies, in airports overseas, or is it mainly just paperwork you're looking at?
No, it's a combination of things. It's more complicated than that. Unfortunately, the border is quite a complex mechanism. We do have Border Force officers who work in overseas airports. They're called airline liaison officers. They don't work in uniform, but they do work with airlines, particularly at the point of check-in. And what their job is to make sure that travellers coming to Australia have a visa, that their travel documents are bona fide, and of course in this particular case making sure that they're well and working with the airlines to ensure that. Of course they can check passports for stamps to see if people are travelling from hotspot locations, and they can also of course engage with travellers to ask them questions about how you're feeling. What we want to really do here is deter people from making a decision to come to Australia if they're not feeling well, and realise that if they do try and get to Australia and they're not feeling unwell, there's a risk, of course, that they might not get through the hub airport, and there's a risk also, of course, that they could be put into quarantine when they arrive in Australia. So we just want to make sure that our communications with passengers before they get on an aeroplane are calibrated the right way and correctly. And so we'll be looking at a whole range of mechanisms through officers at airports overseas, our communications with the travelling community. We don't want to stop people travelling to Australia. We just want to make sure that people are armed with the right information, but also to make sure that we, as we have been doing, we surge onto flights that are higher risk. I mean, we've already intervened with probably 500,000 passengers over the last couple of weeks, where we've enhanced our screening of particular flights and passengers that have come to Australia.
The 2-week incubation period will make things difficult for you, I'm sure. So when it comes to airports and airline passengers, will you be monitoring every passenger that arrives in Australia?
That's impossible to monitor individually every passenger that arrives in Australia. Obviously, you're talking about millions of passengers. But let me say this, our universal visa system means that we have a pretty good sense of who's coming in here and where they're coming from. And every time a passenger checks in at an international airport, we get a notification about the fact that passenger's checked in, which flight they're on, and the fact they're coming here. And we obviously marry that information up with our information holdings that we have. And that's the basis on which our officers at the Australian airports actually intervene with passengers. So we don't check every passenger, we don't talk to every passenger, we don't screen every passenger, but we deal with this on the basis of risk and the information and the data that we have.
So we've seen in China, for example, they've had sections set up on main roads, trying to stop people from travelling, setting up roadblocks, monitoring their temperature. Do we have anything like that at our airports, temperature monitoring?
Oh, we have had temperature monitor at airports, yes, and so we work very closely at our airports here in Australia from Department of Agriculture, the biosecurity officers, and there have been public health practitioners working with us at the airports. We've actually, as a result of that screening exercise at Australian airports, 70 passengers since the 2nd of February have actually been sent to hospital for further tests. Of course, they've all turned out to be negative, so that's been pretty effective.
Okay, airports is one thing. We've seen a bit of a problem with cruise ships right around the world. We have many cruise ships, of course, coming into Sydney Harbour, for example. Will Border Force be stepping up their operations around those?
In fact, we have been doing. We've been engaging with the international cruise ship industry. And in fairness to that particular industry, they've been ahead of the game here. They really started imposing their own restrictions on criteria for passengers getting on board those ships and where they'd been before actually our measures were introduced. So we do already work with cruise ships in relation to passengers coming to Australia. They need to clear customs, quarantine and immigration, of course, before they arrive at any of our ports. And of course, from a biosecurity point of view, they need to make declarations before they come alongside in relation to whether there is any illness or sickness on those ships. Of course, most of those ships, their passengers haven't been in China in the last 14 days. And so we've got a reasonable amount of assurance. But of course, as this coronavirus spreads, we'll have to be more vigilant and work more closely with the cruise ship industry in particular, but also, of course, the cargo industry.
Yeah, so what's happening with the cargo industry? Is there a risk that coronavirus could spread through cargo goods that we're receiving?
Well, the main good news story there is, of course, we've managed to keep working with the ports and working with the Department of Infrastructure and Agriculture, keep our ports and our trade lanes open. But yeah, we have had to imply some restrictions there in terms of crew, who have to make a similar declaration that air travellers have to make. You know, have you been in mainland China in the last 14 days? And of course, some of those ships actually have to go to China to either, you know, get cargo off the ship or put cargo onto the ship and bring it back to Australia. So if they have been in China, or mainland China, the last 14 days, then there are restrictions, quarantine restrictions that apply to the crew.
Okay, of course, your men and women are on the front line here. Are you comfortable that they have all the extra health precautions for your personnel?
Yeah, I am, and let me say that they've done a fantastic job. They're very professional. They know the mission is, they know how difficult it is. They're there at the airports, at the front line, but you'll see them wearing their PPE, that's their masks, their gloves, and of course engaging in all those hygiene activities, washing hands and those sorts of things. And we're providing constantly updated health advice to our workforce and making sure they've got that protective equipment. So yeah, we're very concerned obviously about the health and well-being of our workforce, but also very proud of them and the work they're doing.